It is a fact that 15% of women of reproductive age do not ovulate. That is, they have anovulatory cycles, often without even realizing it. This is a fact that you should know. Anovulation only becomes a problem when a woman is actively trying to conceive. That is when she finds out that she is not ovulating because she's trying to achieve conception and she's not getting pregnant. Tests are done, investigations are done, and it reveals that she's having anovulatory cycles. Fortunately for you, this issue can be resolved. That is, not ovulating can be treated depending on the cause. So come with me on this video and know the reasons why you are not ovulating, causes why you are not ovulating, and treatment regimen for different anovulatory causes. When you start trying to conceive, that is when being not able to ovulate becomes a problem. That is when you actually find out that you're having anovulatory cycles and then you cannot get pregnant. But fortunately for you, anovulation can be treated. Yes, anovulation can be treated. So come with me on this video and learn the reasons why you're having anovulatory cycles, why you are not ovulating, and the treatment regimen that is best for you depending on your cause of anovulation. What is anovulation? Anovulation is a type of ovulation problem where you are not either producing eggs, or the eggs you are producing you are not maturing it, or the eggs that are matured do not burst open to release the contents so that fertilization can take place. That is what an ovulation is. There are various causes of an ovulation. Over the time, researchers have done different researches and they have found out the causes of ovulation, which we'll be listing out right now. Before we dive into the causes of anovulation, let me introduce myself. My name is Sandra Uyi Odafe. I am a registered nurse. I am a registered midwife, a registered cardiothoracic nurse, and I hold a degree in nursing science here in Nigeria. Over the years, I have worked in various settings, and maternal and child health is one of it, which has made me to come across different reasons for people coming to look for issues causing their infertility. And over the years, I have found out that there are so many people who have infertility issues where the reasons behind it is an ovulation. And that has moved me to drop this video to talk about these issues so that women of childbearing age, especially those who are facing infertility issues, will know about this and then learn what to do about it. Please, if you love this video, give this video a big thumbs up at the end of watching, and also do not forget to click on the subscription button below to get informed anytime I drop new videos. This is just extra with Sandra, where we drop content on hair and skin care, health, feminine hygiene, motherhood, and Homefront Finance. Why? Because a woman is not complete without how she manages her finance in her home. If this is the kind of content you love, why not consider subscribing to my channel by clicking on the red subscription button below? Before I jump into the causes of anovulation, first of all, let me talk about the different types of anovulation that we have. We have two major types of anovulation. First of all, we have the sporadic anovulation. For the sporadic anovulation, what happens is that a woman of childbearing age, at one time or the other, she does not just ovulate. That is, it doesn't occur constantly. It is not chronic. It occurs once in a cycle. If in a year you have 12 cycles or 13 cycles, probably 2 or 3 of those cycles you do not ovulate. That is what sporadic anovulation is. The second type of anovulation is chronic anovulation. That is what you find in people who do not ovulate at all. Throughout the cycles that they have, there is no ovulation occurring. That is chronic anovulation. Before we talk about the causes, let's know what the effect of anovulation is on fertility. If you do have anovulatory cycles, it will be impossible for you to conceive. If you are the type that experiences sporadic anovulation, you may not have issues with conceiving. That is to say, if that particular cycle that you're having, there is no ovulation, in the next cycle, ovulation could occur and you could get pregnant. But for those people who experience chronic anovulatory cycles, conception, that is, getting pregnant, is absolutely impossible because there is no way you will get pregnant without ovulating. Without ovulation, pregnancy cannot occur. So that is how important this topic is. That is how important learning the reasons of anovulation and tackling it to avoid infertility is. The reason is not far-fetched. 10% of couples experience infertility issues, and of these, 40% causes are due to anovulation. So you can see that this topic is very important and needed at this particular time where so many people are having issues with fertility. The most common causes of anovulation is polycystic ovarian syndrome, PCOS. Yes, this is a situation or this is a condition where you have so many cysts in the ovaries. So many cysts in the ovaries. It is also associated with menstrual irregularities and other abnormalities that goes with this. Most of the other causes of anovulation are related to hormonal imbalance or chemical imbalance in the body. And these causes are: one, reproductive disorders such as premature ovarian failure or low ovarian reserve. That is, the eggs in the ovary that are supposed to be producing and maturing and releasing every cycle, the number is reduced, probably because of hormonal imbalances in your body or chemical imbalances in your body. This can, in the long run, cause anovulatory cycles. Another is due to hypothalamic or pituitary dysfunction. The hormones responsible for ovulation are produced by the pituitary gland. If there are issues with production of key hormones responsible for ovulation, then you agree with me that ovulation will not occur. And the reasons that can cause hypothalamic or pituitary dysfunctions are strenuous exercises. Strenuous exercises is not so good for women of childbearing age. If you want to do any exercise, do exercise that is okay for you. Do not indulge in so much strenuous exercises. Another cause of pituitary or hypothalamic dysfunction is body mass index. That is the fat deposited in your body, the relationship of your fat tissues, fat fat the relationship of your weight to your height. That is body mass index. And if it is so high, if it is so much, that is, if you're so big and so obese, this condition can cause hypothalamic or pituitary dysfunction. And when this dysfunction comes about, key hormones responsible for ovulation are not produced or are not produced in the right quantity. And at the end of the day, you can suffer anovulatory cycles. Another common causes of anovulation is with the endocrine system. When you have issues with the endocrine system, for example, excessive production of prolactin, that is called prolactinemia, hyperprolactinemia. If you have hyperprolactinemia, you're going to suffer from anovulatory cycles. If you also have congenital adrenal hyperplasia or you have thyroid dysfunction, These hormones have a role that they play in ovulation. So having this condition will cause issues with key hormones regulating ovulation, and at the end of the day you're going to suffer anovulatory cycles. In summary, the causes of anovulation are low ovarian reserve, premature ovulation failure, endocrine disorders like hyperprolactinemia, congenital adrenal hyperplasia, or thyroid dysfunction. Three, you have hypothalamic or pituitary dysfunction. Under this, where you have excessive strenuous exercises, prolonged stressful conditions. You also have high body mass index, that is excessive body fat or low body fat. Signs and symptoms of anovulation. What are the things that you experience? What are the things that you see that would make you to suspect that you are having an ovulation? If you are seeing or experiencing any of these symptoms I'm going to mention, please you should go for further diagnostic evaluation so that a proper diagnosis can be made and then treatment can be commenced as soon as possible, especially if you are one who is trying to conceive. One is oligomenorrhea, that is having cycles longer than 35 days. When you have cycle length longer than 35 days, you should go for further evaluation because it could be a sign of anovulation. Secondly, polymenorrhea, that is having a cycle length shorter than 21 days. When you have a cycle length shorter than 21 days, you should go for further evaluation because you may be suffering from anovulatory cycles. Amenorrhea, total or absence of menstrual periods. That is, you do not menstruate at all. It is a warning sign. It is a sign that you may be having an ovulatory cycles. It's a sign that you are not ovulating. For you to be suffering from amenorrhea, there are other causes, but one of the major causes of amenorrhea is an ovulation. So you should go for further reevaluation. If you're someone who does not see your period at all, you need to go and check yourself out. Also, another symptom is menorrhagia. Menorrhagia means excessive menstrual bleeding. If during your menstrual period you have to use more than one sanitary pads, two, three packs of sanitary pad, not how it used to be. When something is excess, you should know. If you're having heavy bleeding during your period, you should go for evaluation because you may be suffering from anovulatory cycles. Polymenorrhea. If you're someone who is experiencing light bleeding during your menstrual phase of your cycle, that is during your bleeding phase, if you are menstruating and you're just passing out light blood, you need to go for re-evaluation because you may be suffering from an ovulatory cycle. Dysmenorrhea is another common symptom of anovulation. What is dysmenorrhea? Painful menstrual periods, painful cramps, painful lower abdominal cramps, painful cramps when you are in your menstrual phase of your cycle. Now, if you are one who experiences painful and discomforting cramps during your menstrual period, then you should seek re-evaluation because you may be suffering from an ovulatory cycles. The last but not the least symptom I'm going to talk about is metrorrhagia. That is, you have intermenstrual bleeding. If you have your menstrual period at this particular time, before the next cycle, you see spotting, you see bleeding in between. That is metrorrhagia. It is a common symptom for those who are suffering an ovulatory cycles. If you are one of them, you should seek re-evaluation because you may be suffering from an ovulatory cycle. Another common sign of anovulation is when you're suffering from hormonal imbalances. If you go for checkup and you assess the level of your key hormones responsible for ovulation, like the follicle stimulating hormone, the luteinizing hormone, and these values are not the usual one. They are either they are lower than the values you're supposed to get. It may be that you're having anovulatory issues. So having hormonal imbalances is another sign that you are not ovulating during your cycles. Also, if you're someone that your anovulatory issue is due to polycystic ovarian syndrome, you may start having symptoms like acne, that is pimples, lots on your face or on other parts of your body. You may also be suffering from hirsutism, that is so much hairs around your body, that is you're having male distribution of hair. You see a lady, you have mustache, you have beards, you have hairs around your chest, you have male distribution of hair. You should go and seek further reevaluation because you may have polycystic ovarian syndrome, which is one of the major causes of anovulation. What are some of the tests that your doctor can ask you to go and have if you have these symptoms? The first is blood tests. You're going to have blood tests to check for these hormones. First, you're going to check for reproductive hormones, that is the follicle stimulating hormone and the luteinizing hormone. You're also going to have a blood test to check for thyroid hormones. Yes, and also check for hormones like prolactin. Yes, because you have seen that hyperprolactinemia can cause anovulation. Thyroid dysfunction can cause anovulation. Also, you are going to carry out some investigations, some scans. First of all, you have pelvic scan. You're going to do a pelvic scan, but I will advise you do a transvaginal scan because a transvaginal scan is going to check out your ovaries, it's going to check if you have polycystic ovarian syndrome, it's also going to check at a particular time of your cycle, that is the level. On the level of your cycle, if you have a scan done, it's going to show the level of maturation of your eggs, whether they are going towards maturation and whether at the end of the day they are going to burst open and release the egg, which is ovulation. Yes, you can have a transvaginal scan to monitor it. You check on the level, you check on the 13, you can also check on the 16 down till day 21 to monitor your ovulation, to see if the egg actually matured, and if after maturation did it burst open to release its contents, which is ovulation in quotes. Yes, you're going to see all this when you do a transvaginal scan to monitor the process over these days of your cycle. On the 11, day 13, day 15 or day 16, day 18 up to day 21. These times when you have a transvaginal scan done, you are going to see if actually you are ovulating, and if you're not ovulating, you are also going to see it. So that is why I always advise my clients to have transvaginal scan done. Having talked of the various causes of anovulation and the investigations that you could do to actually diagnose whether you're suffering from anovulation, let's talk about the treatment options. It might interest you to know that anovulation is treatable. Like I said, in many cases, anovulation can be treated. Anovulation can be treated, but the treatment measures you're going to use and the efficacy of each treatment measures depends on the actual cause of your anovulation. So let's talk about the lifestyle changes that you should carry out first of all if you are suffering from anovulation. Lifestyle changes involves first of all, if you're very obese, you have to think of a way to reduce obesity. Reduce obesity by eating right, taking the right diet, doing the right exercises, not so strenuous exercises. Yes, reduce your weight, carry out exercises, the one that is right for you, not so strenuous. Carry out exercises as you can do. Also, eat healthy diet. Eat right. Do not consume a lot of fatty foods, oily foods, wrong foods, or eating at the wrong time of the day. Some of us we eat very late into the night. No, please eat right and also eat good food. Yes. If you're one who is very lean, please, you have to think about increasing your weight a little. I'm not saying you should go and become obese, no, but do not be too tiny, because if you do not have enough of body fats, you can also suffer from anovulation. Like the saying goes, everything excess is not good. So moderation is the key. Being too slim is a no-no. Being too obese is also a no-no. Try and achieve a balance. Yes, try and achieve a balance. Stress reduction. Stress, like I said, prolonged stress can have effect on the pituitary gland and affect your ovulation. So try and reduce your stress. Any stressful issues, whatever is around you that is causing stress, please try and do away with it. Try and reduce your stress to the barest minimum level. Yes, very, very important for your fertility. After taking care of those lifestyle changes, there are some drugs that could help you to induce ovulation if you are still not ovulating. Yes, one of such drug is clomid, clomiphene citrate. It is used to induce ovulation and it has worked successfully in over 80% of women who use this drug to induce ovulation. I'm going to put out a video on how to effectively use clomid to achieve conception. Yes, for another video, not this one. But just know that clomiphene citrate is a drug that you can use to induce ovulation. If all of these methods do not work for you, then you may be a candidate for assisted reproductive technologies like IVF, in vitro fertilization, and also artificial insemination. In these procedures, drugs, very strong drugs, will be given to you to induce ovulation, and after which fertilization will be done by introducing your partner's sperm to meet with your egg outside the body if it's for in vitro fertilization, or inside your body if it is for artificial insemination, so that at the end of the day you can achieve conception, which is what we actually want to achieve, that conception. Yes, so that is where I'll be drawing the curtain today on our health series. Yes, thank you all for staying with me up to this point of this video. If you're yet to subscribe to my channel, what are you waiting for? Please click on the subscription button below, and also be sure to turn on the bell notification close to the subscription button to get notified anytime I drop a new video. That is all we'll be talking about today on our health series on this channel. Until I come your way next time, please have a lovely day ahead.